Hello, everyone. We can't see you and we're not in the same room, but we would love this to be interactive in the chat box. And so if you could just, your name, where you're coming from, that would be great so that we can give you a shout out. My name is Caroline Uya, and welcome to Building Resilience, where we'll be talking about practical tools for supporting survivors in the workplace. And we'll be coming at it from an angle of being an employer, right? Being a supervisor, and how to support your employees and the people on your team. A little bit about me. I have, my role at Futures is that I'm a senior training and technical assistant specialist. So I help organizations, work on increasing employment and education opportunities for survivors. Prior to this, I was working for a victim service agency that did workforce development and small business development. And so I'm very aware of the intersection of victim advocacy and mental health, as well as workforce development. I'll turn it over to you, Jen.
Thank you, Caroline. So hi, everyone. So good to see everyone coming in to our virtual space. I'm Eugen. I use she, hers pronouns, also a senior training and technical assistance specialist focusing on workplaces and our Workplaces Respond Center. And so my background is in victim advocacy at a domestic violence center as well, substance abuse prevention and intervention, as well as trauma-informed care. So really excited to connect with you all today. And thank you to everyone who's introducing themselves in the chat.
Right. Hi, Krista, coming from Illinois. Walter from Fort Knox, we are grateful to have you. And hey, Mary Lou. Okay, so let's talk a little bit about our project. So I work on promoting employment opportunities for survivors of trafficking. We offer free technical assistance to pretty much anyone in the United States who is looking to improve how survivors are connected to employment or education. So if you need help troubleshooting, any issues or creating programs or a needs assessment, building partnerships or collaborations, then we are here for you as a resource, and we'll continue to talk about how we can do that throughout the presentation.
Alrighty, and so just like we mentioned, I am focused in our National Resource Center, Workplaces Respond, workplacesrespond.org, where we have a ton of different resources for employers, for managers or supervisors, for coworkers, focused on how we can create safer workplaces, like it says here, free from domestic and sexual violence and stalking, and then also thinking about how we can create more trauma-informed and survivor-centered workplaces.
So why are you here? Why are we here today? So this is the goal, and we hope that you help us reach these learning objectives by asking us questions and helping us clarify anything that seems confusing. So the three objectives that we have for today is to just have a conversation about the current mental health challenges of survivors in the workplace, the impact of COVID-19 and trauma on employment success. And so while we are speaking from a survivor lens, this information is great to know for just about anyone that may be in your network. We'll also identify key elements of a supportive and trauma-informed workplace. So what does it mean to be a resilient space for others? What does it mean to be in community in our place of work? So we'll have some conversations about that. And then we'll talk a little bit about policies and resources to help survivor mental health in the workplace. So what can you do to make sure that your policies are inclusive and safe and mindful of all the different mental health challenges that people experience? And then our last is we hope that we can develop some strategies or share some strategies that enhance and support employee workplace resilience. So we'll be giving a lot of resources that you can go back and look through. And then we ask that you just contact us so that we can actually have a conversation about them and help you implement them along the way. So now that you know a little bit about us, Eugen is going to put a link in the chat box And if you can go to the link, can you walk them through that, Eugen?
Yes, so, right. You're going to get to know us a little bit more, but we'd love to know who's in the room. So if you could visit our Poll Everywhere link, we'll be using that throughout the webinar to engage with you in different ways. But for right now, you'll probably see a screen that gives you a few options on what best describes, what's the closest thing that describes what you do. And so we'll wait for a few answers to come in. And if you're not for any reason able to access Poll Everywhere, you can also let us know in the chat.
Right. I see Susan from Atlanta. I grew up in Atlanta. Hi, Susan.
Yes, folks from Texas, Indiana, California. Welcome. All right. So let's see. Okay, so we're seeing some domestic violence, sexual violence victim service providers, a few policy specialists, some educators in the room. Awesome. Great. And it's always wonderful for us to know, especially since we can't gather in a physical space yet, to know who's in the room and also what wealth of expertise we bring as a collective. Wonderful.
Okay. So let's go ahead and start a conversation. So we ask that you use the chat box, or you can use Poll Everywhere if you would like your contribution to be anonymous. And so we'll put the link. The link should be on there on the chat box. But the question that we want to ask you all is, what factors impact employee retention the most in your organization? So if you could take a few minutes to just, type in your answer or perspective of this, or click the Poll Everywhere, we'll kind of get a sense of where everyone is coming from or what your challenges are. And another way to look at the employee retention, or if you are retaining, well-being, what is impacting employee well-being in your organization is another way to look at it.
Yeah, so I'm seeing some responses from folks in the chat and also in our anonymous share. So comprehensive and trauma-informed supervision. So glad you brought that up, Stephanie. We'll get into that. Burnout, for sure. I'm seeing not being valued, workplace policies, inclusion and pay, opportunities for personal and professional growth, funding, yes, and burnout.
Right. So these are all important, and it's good to know, especially the burnout, and Stephanie, the comprehensive and trauma-informed supervision will really talk a lot about today. So thank you for introducing us into the topic.
And I'm seeing some responses around stigma, around reporting sexual harassment and sexual assault in the workplace, open communication about this and how to make people feel safe. Burnout, not enough time where people are paid, being short-staffed, lack of transparency and follow-through from leadership.
Awesome. Thank you for those perspectives, and we hope that some of the resources we share will start to address those issues. So before we dive into sort of what do we do, let's look at what's going on. And so I'm going to talk a little bit about the impact of mental health in the workplace. And once again, I want to remind you that we're taking an employer or supervisor lens. The first thing that we want to talk about is workplace stress and employee burnout, which all of you have mentioned in the chat box and in our poll everywhere. When we look at the statistics out there, particularly from the CDC's Mental Health in the Workplace study, Mental Health America also did a wonderful study called Mind the Workplace. These are the trends that we're seeing. They have identified that the workplace is the third leading cause of stress. Which is saying something. We're spending a lot of time there. There's a lot of stress that we get from that environment. And so it's our responsibility to figure out how do we address that. And then only 5% of employees strongly agree that their employer provides a safe environment for them and helps them, kind of navigate their mental illness, or has a safe environment to navigate mental illness. So only 5% is very, very small, in my opinion, and I hope in your opinion as well. So we have to figure out what are the different strategies we can do to shift that number, so that more people are feeling that they are supported by their employer and at their place of work, regardless of what challenges they're experiencing. 3 in 5 employees are not receiving adequate support from supervisors to manage stress, and 4 in 5 employees feel emotionally drained from their work. So this just shows us that stress, burnout, mental health challenges, such as depression, anxiety, and if we go even further, bipolar, schizophrenia, all of those different diagnoses are going unsupported in the workplace. And so we have to ask ourselves, what can we do to address that? If we look at the financial burden as an employer, mental health challenges like depression and anxiety cost the global economy about $1 trillion per year. And lost productivity. Now, I don't know about you, but 1 trillion is a lot of money. So it means that we need to really address it instead of ignoring it the way that workplace culture tends to do, and really shift that culture. One, because it's the right thing to do. We want healthy employees. But 2, we want to save some money. We want to make sure that we are using our dollars wisely and they're going into the places that are needed. When you also look at the research, employees with depression miss about 27 days of work per year. And that's about $4,500 lost a year. And that's an average. We know for some it's more, depending on how pervasive the challenges are or what the violence that individual is experiencing. And so with that understanding, what can we do to adjust that? And then for this statistic, I think is quite powerful for us to know, instead of focusing on all the things that are going wrong or not supportive, every $1 invested in evidence-based programs, an employer can save $2 to $4 on other expenses. So this just lets you know that investing in this, while it can seem painful at first, actually saves you money and time and productivity in the long run. So it's worth really diving into those meaningful conversations with your supervision team, with your, if you are the boss at your organization, to really have conversations about this. The next thing that we'll talk about is what is trauma. So Eugene will walk us through this.
Right, so trauma, we wanted to start with just a universal definition that we'll be using for this particular training, coming from the Substance Abuse and Mental Health Services Administration. A mouthful. SAMHSA is usually what we say. And so thinking about how trauma is an event or a series of events that are experienced in an individual's life, in which there was physical or emotional harm or life-threatening harm. And this trauma tends to have lasting adverse effects on an individual's functioning. And that means mental health, physical health, social, emotional, spiritual, everything is impacted by trauma. And just wanting to uplift one of the shares from our poll everywhere, that one thing that this particular person in this organization does is attending a secondary trauma care group once a month and trying to address this. So this is wonderful, and we'll get more into how this will connect with our work. All right.
So now that we have that definition, let's talk about the prevalence. Unfortunately, because of stigma and the way society has, tends to discuss mental health or trauma or challenges, it makes it seem like it's happening, it's something that's not happening to everyone. And so we want to give you the statistics so that you know how prevalent it is. A national study found that 89.7% of adults have been exposed to at least one traumatic event in their lifetime. So 89 to 90% is a large chunk of your employee population. And so that means that we have to be mindful of what it is and how it can show up in the workplace, because more than likely, a majority of your workplace has experienced some sort of trauma. We also know that in the United States, 52 million women and 27 million men experience sexual violence. So once again, that just lets you know that the number is so much higher than we give credit to in our community and in our, in the workplace, to be honest. And then we also, when we look at stalking, 19 million women and 6 million men have experienced stalking. And stalking is something that really impacts the workplace that can be very, dangerous. And so it's important for employers to be mindful of what that looks like and have policies in place. And we'll talk a little bit more about that. And then the last statistic that we want to share with you is that 43 million women and 37 million men will experience intimate partner violence in their lifetime. So we just want to share this prevalence to let you know that this mental health challenges, trauma, violence, victimization is not happening in silos. It's not something that's happening in the corner at dark that's not going to affect your workplace. And so we just want you to know that a majority of your employers have experienced some level of trauma. And so we have to identify what do we then do about that to ensure that they're well supported.
Thank you, Caroline. And just thinking about, going right off of what you just shared, this is only accounting for specific kinds of violence and trauma that have been experienced. And so we think about intersectionality as we do this work, the impact of racial trauma, the impact of so many different systems, and also what's been happening with the pandemic, with coronavirus. And for many, we have many people from different organizations sharing with us, wow, we're really seeing and noticing different kinds of trends coming up as a result of this pandemic, where all of us are showing up as our full selves, but also many of us are working from home. And so thinking about how this is impacting our workplace and our mental health, compounded trauma, perhaps you've been impacted directly by coronavirus, whether that's death, sickness, loss of a job, financial cuts, thinking about maladaptive coping when we are in a high pressure situation for a very long time, and missing the connections and maybe the coping mechanisms that we typically use to feel more balanced. Again, the financial pressure or instability. And then again, just thinking about, even if it's not directly impacting us in terms of the sickness or death, being surrounded by news and maybe coworkers or colleagues who are impacted by this.
Right. And a little bit about the maladaptive coping and just COVID-19 in general. Statistics are showing that there has been an increase in substance misuse or abuse during the pandemic across all demographics, right? And so unfortunately, it has taken the pandemic for a lot of employers to start really talking about mental health and really looking at their policies that are in place to support their employees in this area. So the good thing about that is that means it's going to happen, that we're having the conversations as a result of what's been a very difficult time for everyone. And then just to go a little bit deeper, which we've mentioned, the types of mental health challenges, we have people, some of us have experienced adverse childhood events that show up in the workplace, complex trauma and polyvictimization. A lot of times, people aren't victimized just one time or in just one way. It's compounded, many different types of victimization in one. So how do we address that? There's also co-occurring disorders. So we tend to focus on just depression and anxiety, but we don't look at, the bipolar disorder or schizophrenia or some of the other diagnoses that, still have a lot of stigma associated with it. And so we have to bring that to the forefront and have conversations about those diagnoses just as much as we are depression and anxiety. And then I've mentioned the substance abuse. Now, when we talk about the barriers to getting care in the workplace, like we know what the barriers are. Part one talked about the barriers to getting care, in general and community. But in the workplace, these are some of the things that have been identified. The first is stigma. We don't want our bosses to know that we're struggling. What are they going to do about that? What retaliation, fear of retaliation? Like, are they going to take it out against me? Are they going to view me as weak or different, right? There's lack of flexible schedule. So if, I am dealing with a mental health challenge, is my employer going to be flexible with me and allow me to maneuver those experiences and still be productive? There's lack of confidentiality. So unfortunately, employers aren't always great at being confidential with what is being shared with them. So what happened as an intimate conversation then becomes a running rumor, or a running conversation among all people in the workplace. So then that makes you feel very exposed and also can hinder your relationships with your coworkers, or your ability to even advance, right? So these are some of the barriers that prevent individuals from really disclosing what their challenges are in the workplace. And if you can think of any other things that kind of are barriers to care in the workplace, we encourage you to put it into the chat box as well. Some other things that we'll talk about is lack of comprehensive health care. Sometimes employers might not be able to subsidize a strong and robust mental health, package for individuals. So that can get in the way as well. So let's go into victimization. How does that impact the workplace? So when we look at coworkers, victimization can impact the ability for coworkers, and even all employees, everyone that's within the workplace. They're concerned about their own safety, right? So if what is going on with that particular individual enters into the workplace, will we be okay? What will we do in that moment? And I know many of you have been seeing all of these headlines of workplace shootings, and a large percentage of them are often associated with some sort of victimization, some sort of domestic violence or stalking scenario. So that tends to be a concern for coworkers. And we know that nearly 20% of perpetrators of intimate partner violence, or IPV, have reported that, a serious accident has happened at work. Or they weren't able to focus at work because they were distracted from what they were experiencing with their intimate partner violence. So we know that there are certain work environments where that can be very dangerous. If you're looking at the manufacturing industry, or if you're looking at healthcare, or you're looking at some of these industries that require you to be 100% on the job, experiencing victimization and having these mental health challenges can impact the quality of work and then the safety of those who are in that environment. And then if we're looking at the impact on workplaces, perpetrators use employer resources. So, the company phone and the laptops, threatening the workplace, or threatening that those items and resources can be held against that particular individual. And then unfortunately, we know that 1 in 3 female workplace homicides are committed due to personal victimization, due to intimate partner victimization. And often bystanders are impacted by that and a part of that. If we look at domestic violence in general, it costs about $1.27 billion in productivity losses. So that's just domestic violence. But once again, we've talked about how there's poly-victimization, and Eugene mentioned how, there's many other things that could be challenging. And so that number tends to be higher. And then you have to know that businesses bear liability for incidents that, like wrongful termination of survivors. And so unfortunately, because of these fears of retaliation, of safety, of using resources, an employer tends to want to cut ties with that particular employee, to fire them because they don't know how to deal with it and they don't know what to do. And so while that tends to happen, it's wrong. You can face a lot of legal liability issues if you don't maneuver it the right way and offer proper resources. So we just want to make sure that you have everything that you need to address that. And then the last thing that I'll share with you, just so that you know why this is important for the workplace, is that 83% of survivors say that intimate partner violence has disrupted their ability to work. And 60% of survivors reported being forced to quit or were fired as a result of their abuse. So those numbers are really, really high. And so the challenge is, how do we decrease that? What can we do to address those issues?
Thank you, Caroline. Thank you for such a comprehensive overview and a snapshot of how these issues are not just something that happens in the home, right? And it does impact all of us as a community. And so we're going a bit more individual in this slide, talking about what trauma symptoms might be experienced or manifesting for employees as they're experiencing intimate partner violence, sexual harassment, sexual assault. So we'll start with some of the emotional symptoms. So you'll see numbness, apathy, withdrawal. So maybe not being fully present in meetings, kind of not being able to focus, anxiety and fear, guilt and shame for bringing personal things to work, which we all do, anger and irritability, depression, suicidal thoughts. And we also think about physical symptoms. And what we know about trauma is that it's psychosomatic. So knowing that it's both emotionally experienced and experienced in our bodies. So having gastrointestinal issues, headaches, not being able to sleep, sleeping too much, chronic pain, having panic attacks. And then the cognitive impact of trauma can be having, again, difficulty focusing on making decisions, maybe keeping up with deadlines, following through in the same way that you would when you're not experiencing something like this, having flashbacks or hypervigilance, which is when someone is very aware of their surroundings and trying to keep safe. And then a decreased working memory. We also know from trauma and research on trauma that it impacts our brains, it impacts our memory. So short-term memory can be a little bit woozy when we're experiencing something traumatic. Anything? Okay. Great. And then, oh, Caroline, did you have something you were going to
say? Oh, no, you're good. Go for it.
And then just in line with how these individual symptoms can manifest in the workplace is, of course, in performance, not only in showing up and being able to concentrate and do our jobs, but it can also, again, like Caroline mentioned, impact our workplace as a whole. So having increase in personal calls, feeling like unwillingness to report or cooperate with an investigation, appearing agitated, angry, sad, or hypervigilant throughout the day, maybe some irritability that's going to manifest and project onto our coworkers or ourselves, lack of confidence in their ability, and feeling withdrawal. Again, that goes back to the shame piece.
So what we want to offer is the first resource we want to offer, and we're going to put it in the chat, the link in the chat box, is that we have created a guide to recognize domestic and sexual violence signs in the workplace. And so we're going to put that in the chat box, and we ask that you, just review it, keep it on handy, distribute it to your, your work environment so that everyone's aware. Because the very first thing, and the reason we went into detail about all of this is, you have to be able to recognize it, right? Like if you cannot recognize what's going on with your employee or what's going on with your coworker or what's going on in your environment, then there's nothing that you can do about it. And so we want to get better at recognizing these symptoms. And the more that we hear how they show up and how pervasive it is, hopefully the more likely we're able to recognize when something is not going well. So step one is to recognize, and hopefully the details that we provided can be a refresher, or it's a new sort of way at looking at how pervasive these experiences are.
Absolutely. And just one thing I would add to that is when we can recognize when it's trauma versus someone's lack of competency, right? Or their personality. And I think that's so important into this next set of slides that we'll be going through.
Right. So we're now going to talk about the 6 principles of trauma-informed care. So once you have recognized all of the things that are going on in the workplace that are impacting the mental health or the safety of your employers. The next is to really ask yourself, like, what would it mean to be trauma informed? What would it mean to really have that safe space for people? And so we would like to share a resource called the 6 Principles of Trauma-Informed Practices that's been created by SAMHSA, and we'll put the link in the chat box in a bit. But they've come up with 6 principles that ensure that an environment is trauma-informed. And many of you are familiar with this, especially if you're coming from victim services agencies, but it's safety, transparency and trust, collaboration and mutuality, peer support, empowerment, voice and choice, and then being aware of historic, cultural, and gender issues. So safety is always important, first and primary. So if you have a hard time sort of figuring out all the other principles, it's great to start at safety. Is the work environment safe? What is getting in the way of that? And that's always a good place to sort of start and build from. And then the next is transparency and trust. A lot of times as employers, we try to hold back on information because we think that, they don't need to know it yet, or they don't need to know, or, it doesn't concern them. It's just for the leadership team type of disconnect. And what that does is it just further divides, the relationship. It further divides, the sort of cohesion of the work environment. And so the way that you address sort of those tensions is by really being transparent and building trust. And that also means that checking yourself, your own ego, your own, your own biases, right? And being able to present yourself in the most authentic way possible. And knowing that it's okay to say, you know what, I don't have the answers right now, or bringing people in, which is the third point of collaboration and mutuality, and saying, I don't see the answers to that from my perspective, but what do you think? Can you offer us some insight? And then what's important about that collaboration and mutuality is to actually follow through with what has been determined together. So sometimes, we've seen that we do a good job of convening and coming up with these great ideas, but then the follow-up portion of it tends to be lacking, right? And so really asking yourself, if I'm trauma-informed, then I'm following through with collaboration. It doesn't just stop at the conversation, but there's other steps to it in the implementation that should be minded. And then peer support. So, you can't be everywhere at all times. So really leveraging the relationships and the peers around to be a support system in the workplace. So what would that look like? Is it, a mentorship program, buddy systems, learning sessions where people can come together and really support each other, especially in those spaces that you can't get to. And then the next is empowerment, voice, and choice. So a lot of times, employees are not speaking up because they don't feel that they're empowered. They don't feel that their choice matters. And a part of that is not often because we're saying that it doesn't matter, but it's through our actions, right? So it's when I speak up, I don't see any changes, right? Or when I say something, it's not acknowledged. So you have to really be mindful of, I've created the space for people to be heard, but what does that really mean throughout your policies and how the climate of your environment goes? And then also being aware of the historical, cultural, and gender issues. Once again, I'll mention that we're not living life in silo. A perfect example of that is last year when everything happened with George Floyd, the public, killing of George Floyd, and how that was brought into the workplace, both from the historic part of it, of history of, police violence or racism, but also what was going on in that moment and how it affects our ability to show up. And then also cultural and gender issues. different cultures approach things differently. And so it's important to really learn about what cultures are represented in your workplace, and to give room for those cultures to breathe and to live, right? And so what would that look like? And then gender issues, which we'll talk a little bit more about when we get to our gender-based violence policies. And another thing that I'll bring up here is supervision can feel unsafe. You know, that dynamic, that power dynamic between a supervisor and a employee or supervisee can feel very unsafe. Like, am I really allowed to be honest in here? You know, can I really say that I'm struggling with this task? And so, you know, it's really important for us to figure out how can we make that relationship feel you know, more welcome, for people to seek those spaces for support instead of running away from them. All right.
Thank you so much, Caroline. And I also welcome you all. If you are already incorporating trauma-informed principles into your workplace, we would love to hear it. We'd love to know what you all are also doing, or what questions, challenges, concerns that you have. And so many of you on this call who answered our poll everywhere shared that you come from a domestic violence or sexual violence prevention background. And so a tool that is often used in our field is the power and control wheel, the Duluth model. And we also can use that same model and principle to think about how power and control shows up in our workplace. So something like intimidation, coercion, and threats, utilizing privilege, whether it's through race, gender, ableism, or like even supervisory privilege based on leadership. Emotional abuse, especially when I'm hearing about burnout, right? Sometimes there can be a narrative that the work in itself should be fulfilling enough to sustain you. And that can feel really, really invalidating when you're doing 6 people's jobs and, like many of you shared, you're under-resourced. Economic abuse, we think about how the place of employment is literally the source of whether you get money or not. So not only that, but also thinking about salary equity and like who is paid what and why. Using coworkers, whether to spread gossip, to triangulate, and any form of minimizing, denying, or blaming someone. So while we were thinking about bringing in those intersections of both how employees are experiencing trauma in their own lives, whether it's intimate partner violence, sexual violence, and also larger scale forms of violence such as racial violence, and how that's all going to combine in how we show up in our workplaces. And it can even be heightened in our workplaces when we don't address some of these issues, such as how does racial privilege show up in our workplace?
Right. And so we just want you to be mindful of the power and control dynamics that are in the workplace, and how those dynamics can mirror what's going on at home or what's going on, you know, in communities that are experiencing it. And so the workplace essentially becomes a trigger, right? And so you have to ask yourself, how do we address that? And the answers aren't easy, right? And we're not saying that, you know, you're going to take this and be able to kind of create this overnight. But by really looking at those dynamics, you can start to create something that is moving in the right direction. So we're now going to go into building a safer and more resilient workplaces. And so it's pretty much going in through those trauma-informed principles and breaking them down a little bit more. And so the 5 elements is that you're invested in employee well-being. Right? That is first and foremost. A lot of times, you know, from the Victim Services Agency, our focus is on, you know, the community, right? Like the victims and the survivors that we're supporting, that we can forget about the employees that are a part of us, the advocates that are doing the work. Or, you know, even if you're in corporate, right? Like the focus is on the output and the margins, right? That we forget about, you know, the humans that are actually, you know, creating that. And so you want to invest in employee well-being. There's so much resource in the research in the HR space that shows that when you invest in employee well-being, all other aspects of your workplace, of your productivity, of your financial gain increases. And so we want to pull back and really focus in that space as an answer to not just how to support mental health, but all the other things that we are trying to measure. The next is inclusive and welcoming environment. Is everyone welcomed? For example, the LGBTQI community, is there room and voice for that community? Is there room for the BIPOC community? Are they represented? Is it welcoming? Is important for a safer workplace. And then policies and practice, right? So you want to make sure your policies align with what you're saying. And so you want to look at what those policies are and see, are they doing harm, or are they actually, supporting the well-being of employees, so that they're set up for success and growth. And then the last two is, commitment to transparency and collaboration, which we've talked about, and then a strong workplace community. And that's been hard to do virtually for a lot of people who are still operating in that way. And so really looking, now as offices open back up and returning to more in-person spaces, how do we build that community again? When people have been working from home and feeling, a little bit distant, like what can we do to revive that sense of community is something to consider. So if we're thinking about how do you create a safe space, is having discussions among teams about the issues, right? Like they can be taboo, they can feel scary because you're like, I don't want to receive more than I can chew, or I don't want to walk away feeling like I am doing wrong at my job as a supervisor or employee. But it's important to have those difficult conversations, and kind of walk through them. And then publicizing informations about accommodations and how to access resources. So we talked about how it's difficult for people to come and seek support. So as an employer or as a supervisor, to make it easier for them, offer up the information, right? Put them in places that is accessible. Have reminders in your staff meetings that those accommodations are available. And so by doing that on a consistent basis, you are letting that person know, or those people know, that it's something that you care about and it's something that they can access, instead of them having to kind of trudge through all of the paperwork or all of the emotions to try to find the support on their own. And then use opportunities to share share if there's things that are going on in the news that are about well-being or about mental health or about violence, using those to kind of bring up conversations and reiterate your commitment to supporting survivors. So for some places we found that they felt they needed to ignore. If we don't bring it up in the workplace, then it doesn't exist, right? And the way that that's taken on by many sometimes is that, oh, they don't care, when that might not be the case. So by bringing up those stories and having room for them and letting people know, we're committed, then it's a way to just remind everyone that we're in community together. The next is to be prepared. So you want to know what your policies are around domestic violence. You want to know what accommodations you can provide. So if you have an HR team, to really talk to them about that. If someone's experienced abuse, what can you provide? You want to know what resources are in your community, right? So that when someone comes, it's not even an if, because of how prevalent it is, but it's when someone comes, you are prepared to address it, that you're not afraid because you don't know what to do. So find ways to be as prepared as possible to offer resources for mental health and victimization in your workplace. And I see the question from Jacqueline. Thank you so much. So yes, these recordings will be available on the Futures website. And we will be sending out an email to both part one and part two, how to get them and the resources that we're sharing. So that will be coming after this. So thank you for that question.
Wonderful. Thank you, Caroline. And I was just thinking about what you were saying about naming when something is happening both in our world and in the workplace, and how when we don't name something that is true for our space, we might inadvertently stigmatize it and then send a message that it's not okay to show up in a certain way, or it's not okay for this to be happening. So that goes again back into transparency and then flows right into what trauma responsive supervision looks like. And so there's many different aspects of what this could look like, and depending on your department and industry, this may be fluid, but leadership practices that might include clearly communicating your role, what you do, and how you can support as a supervisor from day one. Team management, so having frequent, meaningful check-ins, not just to have them on the calendar, to talk about progress towards goals, and also to ask folks, what do you need and how can I help you succeed here? Going into employee support, practicing open and empathetic listening when you're receiving reports of violence, harassment, or abuse, and when you're receiving information where someone is disclosing whether it's difficulty in the workplace, mental health. And this is a huge one in terms of what open and empathetic listening is. So much of the time we really, in an attempt to want to help, go into fix-it mode. Especially, we notice this a lot with folks who are in leadership positions where, oh, well, you're coming to me because you want me to do something about it. And so part of trauma responsive supervision is to know that first, help yourself understand and check in with your employee to see what is helpful right now. Would you like me to just be here and be present and listen to you? Would it be helpful to brainstorm some solutions together? Here's what happens when you disclose this kind of information to me, and this is the kind of thing I have to do afterwards. So thinking about things like mandated reporting. Personnel management, so providing consistent and constructive feedback related to work performance, creating opportunities to strengthen and enhance folks' skills, and to strengthen where people already have strengths. And when we think about consistent and constructive feedback, I think especially about when people are taken by surprise. So don't wait until the annual review to bring up things that someone didn't do as well as you expected. And that can feel really, really isolating and shocking to folks. I also wanted to note some of the sweet shares in our poll everywhere. So one person sharing about how their boss told them to set aside a half hour each day to exercise. And she said to list it on my work log as secondary trauma prevention exercise. Wow. And being that this is secondary trauma work, it's incredible to hear. Someone sharing, my boss is absolutely wonderful about meaningful check-ins, making sure to have them at least once a week, sometimes twice a week. And that's it. Sometimes there's a pressure that we put on ourselves as managers or supervisors that we have to be perfect or that we have to have all the answers. And so many of the time when we think about these principles, just being present and being very much there to listen can be way more meaningful than when we're in our heads and trying to think of a solution when that's not what's needed.
Right. Thank you for sharing that about the exercise. I think I have to have a conversation with my boss. That's awesome. So let's go ahead and talk about what do we do? So we've thrown out a lot of sort of context of what's happening, but what can we do? So the first thing that we're going to share is a resource on how to reach out, and Eugene's going to walk you through it while I put the link in the chat box.
Okay, so just to preface that, of course, we have these resources and it can be so easy to read it. So, oh, great, just 3 steps and then you're done. But we also acknowledge and want to recognize that having these kind of conversations can be vulnerable and it can feel challenging. And so to also remind you that we are also always here as a resource if you need support or even walking through a situation where you might not be certain on how to best support. When we think about how to respond, we have these 3 behaviors as the start. So acknowledging change in behavior without judgment, being empathetic and supportive, and then connecting to resources. So an example here is listed. I'm worried about you, Caroline. You haven't seen like yourself lately. Maybe you might give an example. I'm here if you want to talk. Is there anything I can do to help support you in the workplace? Which feels really different than when we hear judgment or an assumption of what's going on.
Right. And this is why we say that it's very important to be connected to resources, so that if someone does say, yes, I need help, right? Or yes, I need this, that you're able to, really connect them to that. And it makes you feel more empowered as an employer when you're able to do that. So the next thing also is just building effective workplace policies. So it's one thing to do it in practice, but it's a whole nother thing to ingrain it into the policies in your workplace. And so you really want to have clearly defined, framework of how to safety plan or how to support, investigate, or detect. So because of how likely it is to happen, what are the steps? Are you aware of those steps? Are there policies in place that protect you when you are carrying out, those different steps of supporting someone? And so having a policy in place allows you to feel more empowered in supporting someone during a time when they're in need. Your policy should also include sexual harassment and any other form of harassment, So we tend to have those big generic statements, in our policies, right? But do you really know what they mean, right? And when they show up, are you able to really move and maneuver someone through that experience? And what we tend to find is that some, employers learn it when it happens, right? They're not prepared for it. It happens. And then it's like, let me dig through and see what is in place for this, right? And so, we want to be proactive. We want to be preventative. So it's important to have these policies in place and be aware of them before you need them, because then it makes that experience of supporting someone that much better and that much more trauma informed. Do you have any policies that, talk about, conduct and how that impacts the workplace, especially right now with people working from home? It happened very fast, and moving forward, if you're keeping this as a policy, what have you learned from this past year that's worth putting in policies so that people feel supported and people are aware of how, a work from home or, in person, environment, what those policies are. And then do you have a foundation for prevention and for equity? Once again, it's much more important to be preventative, to lead with the fact that you are an inclusive workplace. And so do you have policies in place that show what does it look like to be preventative? And then equity, are you centering, the most marginalized in your organization and in your community? And are there policies in place for that? Also allowing room for education and evaluation. So a lot of it is trial and error. Like, we know what works, but it's through implementing and seeing, does it work for your community? Does it work for your employees? And some of the things that may work for one organization may not be the best fit for you. So it's important to try that out and evaluate and see if it's working out, and then adjusting your policies accordingly. So I've worked at organizations where their policies are so outdated. They're still, hanging out from when they first opened, maybe 15, 20 years ago, even though they're operating in new faith. Right. So it's important to make sure that those policies are aligning with where you are right now as an organization, because what it does is it empowers you as an employer, and it also empowers your employees to know that there are systems in place that protect them and that protect the workplace. And the reason that we ask that you have a gender-based violence policy and a harassment policy, and that it's very, very comprehensive, is because it affects everyone. When something is going on with the perpetrator, it impacts the survivor and the family, which then impacts the coworker and their friends and the community around them. And then that's brought into the workplace, and it ends up impacting productivity, which we've talked about. So because we know that it's so pervasive, and it's, that it's so pervasive and that it's impacting all of these various areas of our lives, it's important to have a policy in place to address it, because it will come into the workplace. And so we can't ignore it. So when you're looking at a comprehensive gender-based policy, you want to make sure that it's being provided to all your employees, that you have one, and then that it's being provided to employees, and that they're being reminded of it. So it's not one of those things where you're giving giving the workbook, giving some sort of workbook at the beginning and saying, okay, you have everything you need, but actually having conversations about what's in those policies. I'm going to stop here because I think we just got a question.
Yes, we have a question in our Q&A, and I believe someone might have raised their hand.
Okay, so can you support a safe space for trauma counseling for young girls and women? Can you support, so are you saying, can we support as Futures, an organization like that that's offering trauma counseling to young girls and women? Or are you asking what it looks like to provide a safe space in that area? Gertrude, if you can elaborate on that, that would be great. And then the hand that was raised, I saw it and it went away. If you can put your question in the chat box, we just want to make sure that we've I'm not sure how to identify a raised hand. Mary Kate, if you see it on your end and can help us with that, that would be great. So a comprehensive gender-based violence policy, while we wait for that. Oh, okay. Oh, it is working.
All right, so I think it was Bridget.
Okay, so Bridget, do you want to speak? I'll ask to, what's your question, Bridget?
Can you hear me?
Yes, we can.
Oh, okay. I'm sorry. I accidentally clicked the raise hand. I'm sorry.
Oh, no, you're good. We just wanted to make sure.
Okay, sorry, my bad.
Thank you. No problem. Okay. So a comprehensive gender-based violence policy, it covers all employee relationships. It covers contractors and vendors, the locations that you work. So you really want to look at all the places that an employee can be, and make sure that that policy is expansive enough to cover those areas. Okay. And then all employee relationships. So it's not just for the supervisor to supervisee relationship, but it's between coworkers, it's between every single level of that workplace. You want to make sure that you're considering that, and including best practices into your policies. It also has details on how to report and investigate, step by step, and who's responsible for that. Is there a designated person, or is it a committee? Really identifies who's responsible for reporting and investigating when something happens in the workplace. And then it also defines consequences really clearly. So what are the consequences if someone violates the policy? So having this all written down in detail is very helpful, so that you're not scrambling when a situation occurs. And we have a resource that we talk through what a model policy looks like. And so we're going to put that into the chat box, and we ask that you just look through it and see whether your policy aligns with this resource, and reach out to us if you have any questions so that we can support you with that. So if you can put that, now that I'm looking at question and answer. Oh, perfect. Eugene is on it. So go ahead and go into the chat box and save that, and it'll walk you through the steps for that process. And then we want to offer a couple of other resources. And so there's a guide for supervisors on how to prevent and respond to domestic and sexual violence and stalking. There's also a guide that supports how to end gender-based violence. And so if you go to our Workplace Response website, you'll be able to get these guides and help assist you in developing those policies. And then just to reiterate, it's all about training, awareness, support, and resources. And what I want to emphasize here is that it starts at onboarding, right? You know, the culture that you create starts at onboarding, how you communicate with new hires, and what kind of environment you inform them that their place of work is, and really making sure that they're clear of those policies at that point in time. A lot of times the onboarding process is rushed, right? And so, you know, there's policies in place that we don't learn about until, you know, years or months later in the job. And so really reflecting on how can we make sure that we're leading with these policies, so that that individual is aware that it's something that you're taking seriously, and it's something that you have, you know, you've developed a community of support for. Right. And then doing refreshers, you know, constantly talking about it, and having sessions to kind of remind people about what those policies are, and also raising awareness on a regular basis. So the more that you talk about it, the more that you make it a part of your company culture, you're decreasing that stigma, you're chipping away at the stigma that tells people to keep it quiet. And so, you know, doing that on a consistent basis is one way to address that. And then in terms of support and resources, like what assistance do you have in place, your EAP programs, your emergency resources, what relationships do you have with domestic violence agencies or hotlines, but really developing those relationships. A warm handoff is always better, right? So if you have that relationship already, it makes it much easier to connect that individual with that resource.
Great. So thinking of putting some of our principles into practice, we wanted to share the work of Dr. D.L. Stewart in challenging us to think about beyond diversity and inclusion into equity and justice languaging and framing, and bringing in all of these trauma-informed principles with this work. So looking at this chart, this is part of Dr. D.L. Stewart's work, is diversity and inclusion is asking who's in the room. Do we have this population in the room, versus challenging us to think who's trying to get in the room but can't, whose presence in the room is under constant threat of erasure. So this could be internally within our organization in terms of who's represented, who's showing up, and who is being responded to in particular ways. And this can also mean who's in our actual services. Do your services represent the communities that make up your community, the community that you serve, and why not? Thinking about how many blank do we have in our organization, how many women, how many people of color, how many queer folks, et cetera, rather than what conditions and structures, like Caroline was saying, policies and systemic initiatives are in place so that we can maintain diversity and inclusion like we say we value. Is this environment safe for everyone to feel like they belong? Challenging us to think about, well, whose safety is being sacrificed and minimalized in this space, so that we can maintain dehumanizing views. So these are a different way of framing that don't just think about the majority comfort, and also challenges us to think, well, how does this also relate to, again, bringing in a gender-based violence lens as we think about the world that we're living in which we don't exist as just one thing, but so many.
And we want to give you a resource that's helpful. So the Aspen Institute has a job quality tools library, and they have a bunch of practical tools and assessments on how to improve the job quality of your workplace. And so, you know, even for equity and diversity, they have a toolkit that you can assess how equitable is your workplace, right? And so supporting the mental health of your employees means having quality jobs and an environment that is, you know, inclusive. And sometimes we don't know how to do that. So we want to offer this resource and ask that you check into the library, look at the different tools that they have. There's, you know, tests that you can do to kind of assess where your organization is at based on different topics. And then they give you suggestions and resources on how to improve your policies or what you can do to build better support systems. So just know that you don't have to necessarily create something from nowhere. that there are already organizations out here that are doing amazing work and that have tracked it and evaluated it. And so if you're looking for those examples, we encourage you to go to this tools library so that you can see what is available and what is feasible to implement within your own organization. So the link is in the chat box for that. So we're going to look at, examples of a trauma-informed workplace. So we've talked about like theories of what it looks like, but honestly, comprehensive mental health care, and really investing in that and seeing if you or your HR team is in the process of identifying new providers, asking them the question of what do you do to support mental health? What coverage is available for mental health? And leading with that, because often we lead with the other aspects of healthcare, but we kind of use that as a caveat, as something on the side. So you want to lead and really ask those questions to make sure that you understand what they can offer. We've talked about, having the policies for domestic sexual violence, gender-based violence, pay equity, right? It's really hard, for people who are struggling to also worry about their ability to be sustainable, whether they can keep a roof over their head or feed themselves based on how much they're being paid. And so if you look at that Aspen Institute, they have some resources about addressing pay equity. And then having clear standards of growth, promotion, and raises. It's not always clear kind of what the trajectory is. How do I grow in this place? Where do I go if I want to learn more? Are there opportunities for leadership? Being able to build that builds hope, in a person that may be challenged or going through challenges. And so they're able to look forward to, those opportunities to grow and be seen and be heard, regardless of what they're going through. And then the 360 feedback, with Eugene talked about, giving feedback when you immediately, not waiting until, the review or, a few minutes before firing someone, right? You really want to do it, early and allow that person to really grow and learn. And then accommodations, which we'll share some resources on how to accommodate individuals that have different challenges. And then we talked about, paid leave, privacy, confidentiality, pay transparency. So these are just all examples. And we know that you may not have the capacity to look at every single bullet point, at this moment in time, but you're definitely able to pick one or two, whatever your capacity may be, and invest in that space. Because by investing in even just one, you'll see a change happening within your organization. And so really putting in a plan on how you want to implement this and knowing that you don't have to do it all at once.
Yes, and just one thing about 360-degree feedback is also that there's opportunities for you as leadership to receive feedback as well. And so thinking through how we can mitigate those power dynamics so that this can happen. And then one last thing to add is trauma-informed care training for all levels of staff. I hear so much of the time when I work with organizations that folks who are on the ground doing the work that's most traumatizing are the only ones who are learning about trauma-informed care and trauma-informed supervision principles. And then some of the upper management who aren't doing some of the work, there's a disconnect. And then there's going to be a disconnect in how we can show up for each other to support. So again, bringing in anti-racism and equity and trauma-informed care for everyone. This is relevant to all of us. Okay. Seeing a few questions, and I think there was someone who raised their hand as well.
Right. So the first, we'll go back to Gertrude's question in regards to safe space for trauma counseling for young girls and women. So are we able to support setting up a referral, trauma center or referral mental health center for girls and young women in the workplace? So the answer is that yes, we can support with that. If you reach out to us and kind of talk to us about your needs, we can show you what's happening at other organizations and how they address that, and then have conversations about what would it look like to build those partnerships and referral relationships with where you're at. So when we offer our email address, just reach out to us and we can have the conversation just to make sure that we're on the same page with that. And then Carmen asked, what do you mean by pay transparency? So we've been doing a lot of research, and Eugene can check up on this. We've been doing a lot of reading on how pay can be used as a form of abuse by the employer, right? So, coming in and promising one amount, or by this point in time, you'll get this raise, right? And leading with that, but then not following through on it, right? So it's just saying that if you have a system for how you pay or how someone increases their pay, that you're transparent with what that is, right? So that people know what, people are aware of what they can work up to or what they're receiving. And this research that we've done is mostly in service industries where, they're hired and promised a certain amount of hours, but then they don't receive that, amount of hours. And so they're not getting that pay that they were essentially promised in the beginning. And so Sarah Gonzalez, who's our director, has put a great research in the chat box that kind of talks more about pay transparency that we encourage you to look at.
And this can be something as simple as listing the salary on your positions and talking through why some folks are getting paid certain amounts and why others who might be doing the same job are not. So we're also thinking about salary inequity, and if there is just challenging some of the system that might be normalized or conditioned about, well, it's just like our personal opinion that this is why this person is going to be paid this amount, because there's so much room in there for bias. And when we're not working with a trauma-informed lens and an anti-racist and equity lens, sometimes we're reinforcing that within our organization where there aren't clear standards on why some folks are being paid a certain amount, especially folks who are doing the same job.
Right.
And I believe, Daniel, did you have your hand up? If you could raise your hand again. Oh, okay. You asked it here. Are there ways to legally request pay information for people in private organizations? Oh.
I'm not sure about the answer to that question. Are there, to understand disparity. So to see what the disparity is within an organization when it comes to pay. So for nonprofits, I know that there are, and I'm gonna butcher I think it's Bright Star. For nonprofits, they have to list, they're responsible for listing, where their money is going, especially among leadership teams and things of that nature. And so that's one way to kind of look at how things are set up and how pay structures are within the nonprofit context. For sector, I'm not quite sure how that works, and I can look into that for you.
Yeah, I believe in private organizations, no, there's not the same kind of like tax form and requirement.
I think it's GuideStar, not BrightStar. So GuideStar, if you have GuideStar, you're able to look up different organizations and get access to their tax forms. And it often shows a breakdown of where their money is going and different, some of the information on there is in regards to pay structures. So for the last 15 minutes, we are going to ask this question and then provide a few more resources. So what do you all have in your employment assistance programs, or what accommodations do you offer for survivors in the workplace? So, we heard about the 30 minutes of exercise and self-care that's been embedded into the workday. We've heard about the check-ins, but are there other best practices that you would like to share with us in the chat box or within our poll everywhere, so that we're learning from you all as well? And so we'll take a minute for that. Okay. And then while you're responding, we'll move forward since we are coming up on time. So we want to let you know that the mental health conditions are covered under the Americans with Disabilities Act. So if someone is requesting leave or adjusted work schedules or accommodations in regards to their mental health condition, you have to honor that. And you have to be aware of what those accommodations can be. And so, some examples of that could be flexible schedules, or breaks are more frequent and built into the workday. If we're in person and the person requires a safe space to sort of unwind, seeing if you have a special break room or things like that where that individual can use. So really looking into what accommodations can be made if someone speaks up to you. There's also therapy and affinity groups. So while you may not be able to support a therapist on staff, you can create groups where coworkers can really work together. And speak with each other and share what their challenges are. And then once again, we've talked about the benefits. We want to share a resource with you from EARN, which is the Employer Assistance and Resource Network for Disability Inclusion. And so when you go onto this website, they have a lot of resources on what possible accommodations can be for individuals with disability. So if you're looking for a guideline, right, we ask that you check them out and see what practices that they're having that you can implement and keep in mind when someone is requesting an accommodation. And we see Bridget has put paid sick and paid vacation time, understanding that some days are tough and that you can step away from work or leave a day, self-care day, work from home days, and team building. And then from the anonymous chat, a list of therapists who specialize in different areas and therapeutic techniques, and then the zip code. So that's a great idea of putting together a list of even databases. So there's inclusivetherapist.com, there's the Asian Mental Health Collective, there's the National Queer, Therapist of Color Network. So being aware of those and putting that together as a resource so that you can provide it. So EARN also has a mental health toolkit. So if you go onto their website, you're able to look at what they recommend for individuals with mental health challenges. And so that can be a good starting point to see, are we able to accommodate these things? And if not, what would it take to do so? And so then you're not kind of building off of scratch, but using what these organizations have found to be best practices. Some additional resources that we'll offer is the Center for Disease Control has a workplace mental health team. The Psychiatric Association has also a Center for Workplace Mental Health. And then there's, in California, there's a Mental Health Services Oversight and Commission Board. So these are just all great resources to go and get more information on how to build a safer workplace and address mental health in the workplace. So we just want to offer this to you so that you're able to go and look through it. And when we send out the recordings, we'll create a comprehensive list of all of these resources so that you're able to go in and click on them and explore them on your own. Some additional that we'll offer is Mental Health America has Mind the Workplace. Project Trust is an amazing organization that provides trauma-informed practices for organizations. And so if you're looking on how to improve our trauma-informed practices, you can connect with them. And also the Sonar Institute. So they address the impact of trauma in individuals and communities. So these are all people that you can see what they're doing and try to replicate. You don't have to necessarily start from scratch. We also offer the Management Center and the Businesses Ending Slavery and Trafficking. So once again, these are all areas that you can go and see their research, see their best practices, and start to implement what fits right for your particular organization. So as a result of time, and we do have office hours that we're going to be offering, we're going to skip we have an activity that we're going to do. We're going to save that for the office hours section. But the activities is to practice sort of what are the key steps to do when someone is having a mental health challenge or to create a mental health friendly workplace. So for EARN, you'll see that their 4 steps, which is very similar to the ABCs that was shared earlier, is to build awareness in a supportive culture. So know what it looks like and build awareness within your organization. So that's like, what posters are up? What places are there that people can go and have conversations? The next is to provide accommodation. So once you've heard what's going on, be prepared to provide accommodations to show that you honor what that person is going through. The third is offering assistance. So looking at what your employee assistance structure is and being able to offer that. And then the fourth is ensuring that they have access to treatment. So this is when flexible schedules is important. If someone needs to go to a therapist appointment, are they able to take, time to do that? And if so, what would that look like? And so it's one thing to offer all of these services, but if you don't provide the space for them to actually take advantage of it, then it becomes difficult. So really looking at what to do that. Awesome. So we have an employee assistance program that offers behavioral health advisors to talk to for free. That's amazing. So that's a great example of how to do that. And the truth is that if your employee assistance program cannot do this, then you can build strategic partnerships in your community that can offer this support. So we can help you figure out what kind of relationships can that be to offer the gaps that are in your particular program. And then we went through the ABCs. So acknowledging changes in behavior, being empathetic and connected to resources. And so when we do office hours, we'll go through these 3 scenarios and we'll practice the ABCs and the EARN model on how to address someone who is going through different challenges. And then the last thing that we'll talk about is responding to crisis. We want to let you know to be mindful when considering law enforcement. And it's not necessarily because we're, asking that you take one or the, to have some sort of political stance about it. We're bringing it up more from the term of safety. So survivors, if they're going through some sort of victimization, may not always want to involve law enforcement. And we've seen employers sometimes bring that entity in, and it caused the survivor to be in a more unsafe situation at home after the fact. So we want you to bring in collaboration if this is something that needs to happen to ensure that the survivor is aware and that they have a safety plan in place for themselves so that you're not exacerbating what may be going on at home, and just being mindful of how that works out. We also want to bring your awareness to psychiatric emergency response teams and asking for that specifically if someone is in crisis during that time. And really just honoring the autonomy and safety of the survivor at all times. When you can. I know that there's sometimes situations that it's out of your control, but if you have the opportunity to honor the autonomy and safety of the survivor, we ask that you take that. And that can be by just communicating with them, letting them know that this is what we're doing, or this is what we have to do if that's a part of your policy, and working with them through what will keep them safe during that moment. We also ask for you to consider your active shooter trainings and resources and really spend time with that just from a preventative standpoint, especially considering all the trends that we're seeing. And so responding to crisis may involve these aspects. And then to also be aware of the hotlines. So, some of you know the human trafficking hotline, the domestic violence hotline, and the sexual assault hotline. So this can go into your be prepared checklist, right? So that if someone does come to you as an employer, you're able to, call these hotlines to consult yourself. If you don't know what to do, you're allowed to call and say, hey, this is what's going on. I'm not quite sure how to approach it. From your expertise, what do you think? What do you think? And using that to inform your decision making. So often we think that these are resources that are just for survivors or the person being victimized, but you can use it as an employer to gain insight on how to address different situations.
Right, and we also wanted to, and don't worry, we're going to send you these slides. You're going to have these resources at hand, but to highlight another resource we have called Culture Walk, and you can find that at checkyourworkplace.com. It's a worker organized resource that helps us ask questions about what kind of workplace we're in and what factors you might not have considered in terms of, wow, Are all the best spaces in our organization only for upper leadership? Like what message could that send? So they're very practical, tangible reflection questions to literally walk your workplace. All right, and I know we have a few minutes left, and these are just some of the questions that you'll find.
So we'll ask, are there any questions at this point? I know we've thrown so much at you. So, and are there any questions that we can answer in this group? I'm going to take it to the slide of our contact information. We ask that you just reach out to us and we can dive through this in more detail with you and to help you kind of develop these policies and assess whether your workplace is safe for the mental health of survivors and those going through trauma and challenges. We also will be having office hours after the fact. So I just put the Zoom link in there, and that's when we can have more of a dialogue and help troubleshoot any immediate challenges that you may be having or issues that you would like some insight on from what we've seen in the field. But are there any questions that you have that we can answer with these last few minutes?
And please, if you could share your feedback about this presentation, we're always looking to grow and hear from you. We love hearing from you. So thank you, Sarah, for placing that link in the chat as well.
We'll look through. Yeah, well, we hope that we see you at the office hours to have more of a dialogue. We also hope that you reach out to us, especially after getting all the content. Like it can be overwhelming to kind of read through them and figure out what to do with all this information. So please use us as a sounding board to have those conversations and help you kind of figure out where to start, where would be the best place to start or enhance within your organization. So we'll, oh, perfect. I've seen some resources about how survivors of sexual assault are considered a protected class in some states. Are there federal laws that may be pending? I'm not sure about what's going on with the federal laws, but you are right that different states are taking different measures in protecting survivors and putting laws in place that make sure that employers are held to a certain standard when it comes to supporting survivors in the workplace. So I can send you more information about that, but at this point, I'm not sure what it's looking like in the federal law space. We know that they're still having conversations about, how comprehensive VAWA should be, the Violence Against Women Act should be, and some of those other protections. But, we ask that we still have a lot of work to do to make it a federal sort of protection for survivors. And Sarah has put in the chat box that Legal Momentum is a good resource on state laws and protections. And so if you go onto that link, you can see what's happening across the nation in regards to that. Also, Free From has on their website, if you go onto their website, there's a section that you can put in your state and see what the laws are or what the protections are as well. So those are two different places that you can go to see what the standard is in different places. Thank you for that question.
Wonderful. Well, thank you everyone so much for attending and for the good questions. Oh, we have one last one. And just to share,
how do you suggest approaching a conversation with an employer about accommodations for mental health concerns or survivorship? That is a great question. There's so many different ways that you can go about it. Some people tend to do it when they have their check-ins or their reviews. So if you have an employer, an immediate boss, right, that you have developed a relationship with, that you're checking in with on a consistent basis, or you would like to check in with, is meeting with that particular individual and letting them know that you, a little bit about what you're going through, and that you would like to have accommodations, or even asking them like what accommodations are in place, right? And gathering information about what is possible within that organization. So that tends to be you know, the first place to start with that person that you've built a warm, you know, relationship with. And then that person can serve as an advocate on your behalf, right? To help navigate those conversations and point you in the right direction of where to go, to ensure that those accommodations are in place. I'll also suggest for you to visit the EARN website that we've seen, so that you can see what kinds of accommodations have been in place, so that when you're having those conversations, you have an idea of what it is you would like to see, so that you can offer that up and say, hey, you know, is it possible for you to accommodate me for X, Y, and Z, you know, and offering that as a resource, so that you're advocating for yourself as well, right? So those are two different ways that you can approach it. And if you have time to visit us in the office hours, we can talk a little bit more about that. It's not easy. This is what I will say. It's not easy because of all the things that we've mentioned. There is stigma, you know, there is concern about retaliation. All of those things are very real. But the other thing that's real is that it's your right, you know, if you have a mental health challenge, to be accommodated. And so, you know, being willing to have those conversations is important. And finding advocates within your environment to have those conversations is important as well. So the EARN resources is perfect for facilitating those conversations.
Wonderful. Well, we hope you can join us for office hours, and please let us know how we can support you. We would love to connect with you.
Thank you, Mary, for putting that active shooter resource into the chat box. We appreciate you for that. Okay.